our webinar. We try to do these once every couple of months just to kind of keep you informed. Tonight's webinar is everything you want to know about LASIK but we're afraid to ask. Just a couple of housekeeping issues first. First and foremost, if you have questions, we obviously want you to put them in the chat box for the doctors. We'll read the questions, I will read them to the doctors, and they will answer them for you. For your attendance this evening, you will receive $50 off towards your procedure per eye if you decide to book. And we do encourage you to book a consultation tonight if you'd like. Now, if you have additional questions, you can always send those to info@fichte.com, and we'll be able to answer those questions also. So I'm going to stop talking in a moment, but the first thing I just want to say is we are very fortunate to have both Drs. Endl and Elmer here tonight with us. They are both surgeons that work for the practice, been in practice for quite a period of time, have done thousands of laser procedures. So the idea is they both trained together down in New Orleans with some of the folks that actually did the very first laser procedures, and we're very proud to have them tonight with us. So I'm going to go ahead and check to see if we have any questions. Alyssa says hi, a couple other people say hi. We're all happy that you have questions. So the first question is, put this one to Dr. Tom Elmer. And the first question is, I have really dry eyes. Can I get LASIK? So I have dry eyes. Can I get LASIK? Dr. Elmer, please answer.
Sure. We get a lot of questions about dry eyes, and it's very important to ask that, and it's something that we look at for every single patient that comes in for an evaluation. The reason it's important is when we do laser surgery, because of the surgery itself changing the shape of the cornea, some of the nerve endings get altered, and that can cause the eyes to be more dry. So the question is always, what percentage of patients get dry eyes after surgery? Well, really, it's just about 100%. Immediately after, we'll have some dryness, but with time, that gets better. So we have people use artificial tears really every few hours for at least a few weeks right after surgery to restore the eye. Once the nerve endings come back, then the dryness is actually a lot better in the vast majority of people, and it's not an issue. However, if you already have dry eyes before, what we're going to want to do is diagnose that and treat it prior to your laser surgery. Your eyes are so bad that even the best treatments are going to your eyes are still dry, that we would probably actually avoid laser surgery in those patients. But with modern technologies, the vast majority of people can be treated for dry eyes, and we can take care of it before surgery, and then it's not a problem after.
Perfect, thank you. The next question from a person wondering, how long, for Dr. Endl, if I could please, how long is the actual procedure? So how long are you here? Tell us a little about, walk us through a little bit of the procedure briefly.
Sure. So a couple steps again. The question, how long? Well, kind of the most important part. You come in for an evaluation. I would be most thorough eye exam. You're here for approximately 2 hours. Both the front and back.
Just briefly, if anybody out there is losing sound, we may be experiencing a little technical difficulties. We have our IT person working on that. So continue, Dr. Endl. I have a message into IT control, and they're making sure that they can hear you. So again, go ahead. That's better.
So again, how long is the LASIK? 2 hour evaluation. Slap on the front side. All the way.
Dr. Endl, if you can hear me, I'm going to interrupt you for a moment. I'm going to interrupt for a second. I can hear you on my computer. I can also hear you because you're further away in the building from me, but I'm getting some feedback from some of our participants who are saying they're having a hard time hearing you. So I'm going to just briefly interrupt you for a second, and IT is going to work on it. And if people out there can hear me, Dr. Elmer. Dr. Elmer?
Yes.
All right, we can hear you. Dr. Endl, speak again?
So I guess I just have to speak louder?
For some reason, his mic is kind of skipping out, even though you're on the same computer.
No, we don't have any mics. It's just the mic right here.
Right, it's picking up Dr. Elmer. Maybe it's where you're sitting. So I hate to ask you, but slide a little bit over towards your
Sure.
compatriot.
Yes.
Towards the
A little bit this way.
Yeah. And sorry about this, folks. You know, technology is
Sure, no
wonderful.
problem. What I can do is I can go.
That's better.
Let's try that.
Why don't I take another question in the meantime?
All right, let's do this. You know, while you're there, Dr. Endl,
Yeah.
or Dr. Elmer,
So actually, I can start off, Kevin, where he was talking about
pick
the
up where he's
procedure.
talking about the procedure, please.
Okay, great. So Dr. Underwood was saying, you know, a real thorough exam. The evaluation portion is a very thorough exam, 2 or even 3 hours. You can almost guarantee the most thorough exam you've ever had in your life, just because of all the equipment we have. In order to make the surgery super precise, we have a lot of machines to do that. We can actually take computer images of the eye and the way that your eye sees, and that gets transferred into the laser, so the laser can tell us how to shape your eye to make it see the best it can. The day of surgery is actually pretty quick, believe it or not. You come in usually about half an hour before surgery time, and we go over some instructions with you, give you a name tag, take a photograph, and then the surgeon will meet with you, go answer any questions, and we bring you back to the laser room. Believe it or not, the laser fires literally 30 seconds to a minute, sometimes as few as 10 or 15 seconds, depending on the degree of your prescription. So the laser portion is very quick, quite painless procedure. We use a lot of what we call verbal anesthesia, which we talk to you during the surgery, try to keep your mind off what's going on. But you're in the laser room approximately 10 or 15 minutes per eye to have this done, and this laser will fire usually twice, once to make the flap for about 20 seconds, and then another 20 or 40 seconds depending on your prescription for your for the actual exchanging your prescription. So pretty quick procedure. So you're in and out quickly.
Hopefully that answers the question. I have Dr. Endl actually came up and joined me at my computer because, like I say, technology is wonderful. The laser technology works perfectly. The computer technology sometimes has a little bit to be desired. But another question just came through, and they really want to know, what's the age limitation on this? What's the earliest you can have this in your life?
So typically, Dr. Fichte performed LASIK surgery on all 3 of his sons under the age of 20. So we usually say about age 18. That clear dome on the front of your eye, the cornea where we operate, it stopped growing. People may say in their early 20s, boy, my prescription's changing, but usually your glasses prescription would change more than anything that would affect the laser. So most folks, the lower end, between 18 to 20, we'd like to see how stable your glasses prescription is if you have any of those numbers. The upper typically about 50 to 55, because much after 55, people usually start to have some aging changes inside of the eye called a cataract, but we would see that in that 2-hour examination.
Great. Well, thank you, and that's an answer we like to hear. I'm going to go back to Dr. Elmer for a moment here, and they really want to know, you know, how long does it take to heal? I mean, the average healing time after having this done, what would you say is the average?
That's such a great question, and that's actually why we love LASIK so much. The vast majority of people that have a LASIK procedure can pass a driver's test the next day. I mean, it's just remarkable. Even there's times when people will sit up from the laser, and right away they can see a difference. We've even had patients sit up from the laser and start crying because they've never been able to see without glasses. So healing's quick, especially under a flap, and that's why we do LASIK procedure where we make a flap, because the healing can take place underneath that flap. Flap is, you know, pretty solidly down in about 30 seconds. We usually wait about a minute to make sure it's down. We sit you up. You can blink. It's good. And by the next day, like I said, most people can pass a driver's test and are feeling pretty comfortable. You know, we do ask you to wear a shield or some goggles for a few nights just to protect it. We ask you not to do any contact sports or anything for a week or so, just because we want that flap to heal. But most people feel very comfortable within really a day. Back to a lot of normal activities.
Perfect, thank you. The next question in our chat box is, patient is talking a little bit about halos and glare at night, and they really want to know which would they benefit from or by. Would custom procedure or standard LASIK? Talk to us, Dr. Endl, a little bit about the difference between what we can fix these days compared to how halo and glare were an issue in the past, please.
Sure. So a custom laser really is part of the maps we take in that 2-hour exam, as in it takes an optical fingerprint of how light is bent through your eye individually. So two people can have the same glasses prescription, but no one can have the same optical fingerprint, not even the two eyes in the same head of identical twins, okay? So when we come in and take that measurement, a custom laser does your glasses prescription plus all the little nooks and crannies that make you you. Dr. Elmer sometimes say, when you do that much better 1 or 2 test and you get towards the end and you say, oh, I don't know, they're about the same. Well, picture if there were some finer knobs that got very definitive and you say one's definitely better than 2. That's the custom laser. And it's been proven by all the fighter pilot studies that it can make your vision 85% of the time better than your glasses or contacts. And that's what's actually reduced glare and halos to the point where we don't see it as a problem maybe less than 0.5% of patients. So short answer would be yes, if you have some glare and halos at nighttime, likely that'll show up on our preoperative maps as to why a custom laser will treat you better than some of the older technology.
Awesome. Okay. Another question's come up twice, actually, in the last few seconds. I'll address this to Dr. Elmer, please. They want to know the difference in the pros and cons of LASIK, meaning flap, versus having surface or PRK. We do both. We do a lot of either. But please talk about the advantages of either for patients, please.
Okay, first we'll just say that we do both procedures where we do a LASIK, where we're actually making a flap of tissue. As I was mentioning earlier, that's where we actually remove a portion of the cornea, flip it over, laser, and put it back. And the reason we're doing that is for a quick recovery. So that's the biggest advantage of LASIK. PRK, or another term called advanced surface ablation, is an area where we take that cornea here, the front part of the eye. It's almost like a magnifying glass. And we literally just remove the skin layer on the surface with a gentle Q-tip and then laser, put a contact on the eye, and let it grow back. Just so you know, we probably do close to 15 or 20% of our surgeries that way, and the rest are with LASIK. The biggest advantage of LASIK is a very quick recovery. With PRK, the difference is you have to wait for that skin to grow back before your vision will be clear. So that's the advantage. The reason you'd want to do PRK over LASIK mostly is if the cornea is too thin or too irregular and we don't feel comfortable making a flap. So that would be the reason that we'd want to perform PRK over LASIK. And there are patients that we just feel it's the safer way, and we always say we'll always do what's the safest for the eye. PRK is an excellent surgery, and results are as equally good as LASIK. It's just a little longer recovery.
Okay, thank you. One question that's come up repeatedly in a lot of our webinars is around the word astigmatism. And I'm going to have Dr. Endl address 2 things. What astigmatism is, how we can correct it, and also importantly, what's the success rate? Because a lot of people want to know how successful is this. So go ahead.
Right. So go ahead. So when we take a look at the eye, again, that clear dome on the front, if this shows up on our camera here, is your cornea. And when you look at this model, if you were to look at the eye from the side, you typically see it as sort of a half a circle. Well, in Mother Nature, there's not too many perfect shapes in our body. So most people have a little ovalness instead of a perfect circle to the front of their eye. That's all astigmatism is. Sounds like a disease, and it's just a slight ovality to the front of your eye. Well, most people have at least a little of it. Some people have a fair amount. Well, the latest lasers that we're fortunate to have, our Xioptics laser from Technolos and Bausch & Lomb, is actually the only laser that was FDA approved for more accurate treatment of astigmatism than any other lasers previously applied. And it's because it has a tracking system that knows your eye's position when you're sitting up and compared to when you lie down for the procedure. In the past, it was unable to track if our eye turned a little, unbeknownst to us, and we would lose some of the percentage points. Not dangerous, but wouldn't be quite as accurate. Now, whatever angle that oval is on your eye, the laser perfectly picks it up, and even if you're nervous and moving while laying down, it treats all of the astigmatism. We don't lose any of the treatment. So the answer is just like our other patients, with or without eye level. We expect about 98% of patients to be able to pass their driver's test day and nighttime without glasses having laser surgery. So it works quite well. The other 2% do very well, but they may need either a touch-up or a small pair of glasses if they didn't want to do any further surgery. So works quite effectively. And we used to have a billboard that said astigmatism, we can fix it. Because it's a scary sounding word even to primary care docs, but all it means is a slightly irregular shape that the lasers are experts in.
Thank you. And Dr. Elmer, would you address the question of how long does this last? And twofold, the second question is, do any insurances cover it, please?
Sure. So for the first question, how long does it last? When we change the shape of the cornea, like I said, within the first day, most people can pass a driver's test, and we fully expect that that will stay that way for life unless something else changes. The cornea changes shape usually, when people are growing. Most people are growing in their teenage years. But once we hit about age 18 or 20, a lot of things, the cornea pretty much stops changing. So at that point, if we laser it, once it's healed, it should stay for life. So the expectation is if you've been wearing glasses all your life, you do laser surgery, you should not need glasses again for the rest of your life unless something else happened, like you developed a cataract or something of that nature. So the surgery is absolutely supposed to be for life, and that's our plan. There are a few people that change. We have about a 1 or 2% chance where within the first few weeks or months we'll be doing a touch-up. But once that's done, we fully expect it'll be good for life. Are there a few that could change later in life? Certainly it's impossible, but usually less than 1% chance of that.
Okay.
And for the second question about financing and insurance, in West New York, we have a lot of different insurance companies, and we partner with them for even our cataract patients and everything. And with that partnership usually comes a discount towards LASIK surgery. So we do have discounts for patients based on their insurance. Some people are fortunate enough, like the Buffalo school teachers, to have cosmetic riders. For those patients, it's completely covered. And then we also have financing available. We work with a bunch of different financing companies. Care Credit's one of them. So we can often get things financed, and we can do this interest-free for even up to 2 years.
Okay, thank you. Just as a reminder to folks out there in webinar land, there is a yellow button on your screen that talks about our offer to take advantage of our consult. So if you want to book a consult, you don't have to make a phone call. You just go ahead and hit that button, and it gets the process started. And also, again, because you attended this evening, they'll know it was you, that you attended the webinar, and that you get $50 off on it. If you can't see it, then click on the tab that reads Pop-ins, is what my IT folk is telling me. Big yellow button. Okay. Dr. Endl, can you address the situation of flap slippage or flap movement after the procedure? How often does it happen? What happens to facilitate that? What do you do to fix it?
Well, wonderfully, we now do all laser LASIK, which means we have no blades when the flap is created on the front of the eye. Two separate machines, one using many thousands of little bubbles to be placed at any depth in a nice uniform shape. The side of the flap is very pristine. It almost looks like it's fitting into a manhole cover versus a contact lens that would sit on the eye and slip around a little bit. So we don't see that the flap moves much in the first couple of days outside of a very vigorous eye run. After a couple of weeks, we've been fortunate enough to treat at least 20 folks that have either played or currently playing in the National Football League, which is certainly pretty rough and tumble, to move around without any worries. That's one of the benefits of this procedure, is to be active without worrying about your glasses fogging up or your contact lens falling out. If you were to have an injury to your eye at any time down the road that would have been severe enough to injure the eye even without LASIK, yes, a flap could move in that case. But outside of the first couple of weeks, it takes special instruments and a certain pressure and technique we use to get under the flap, even under the microscope. So it's quite secure. And one of the sort of more impressive studies is, again, the Navy Top Gun fighter pilots, who they want to make sure that billion-dollar plane is safe when the pilot goes up. They actually put them through, ejecting out of the cockpit test, which is a pretty violent car accident almost, and did not dislodge any of their flaps post-op.
Awesome. Dr. Elmer, could you talk a little bit about, well, basically a lot of people are wondering about the actual procedure day of. They're worried about, how do I get through this? A lot of people are nervous. They want to know about, sedation, if they're put out, if they're knocked out. How do we get you through this so that it's a comfortable procedure and not traumatic? Go ahead.
Maybe we should let you answer that question, Kevin, because you're the pro at it. But
Thank you.
Kevin is actually our secret weapon when it comes to that. He's been in on 30 or 40,000 cases, and we basically use a lot of verbal anesthesia, which means talking about a lot of stuff that doesn't have anything to do about your eyes, just to make it comfortable. You know, what I often say is when you get really good at something and you do it over and over again, the surgery is very precise. I tell people there's one choice. It's either perfect or we're not doing it. And we do tons of them so you get good at it. It's like if you're good at dancing, you can throw in an extra step. So once where you're really good at it and the surgery's excellent, you can concentrate on other things like how do we make this a good experience for you. And we're very concentrated on that. So from the moment you walk in, the way that we talk to you, the way the room is set up, it's all designed to make you comfortable, and our job is just that, not only to do a good surgery, but to make it so it's a good experience from you through the whole process, from the evaluation, but certainly during the surgery and how you make it comfortable. You know, that works actually for the vast majority of people. There are some people that are just so anxious, all the talking in the world is not going to make them feel comfortable. For those patients, we offer a little medication to ease them. It's like a Valium. We call it Halcyon is the name of the drug we usually use, but like a Valium, they'll just more relaxed. That does it. We can get just about everybody through this procedure, and our job is to help you. And actually, we take a lot of pride in that. You know, how do we make this work a good experience? Some people come in and it's like nothing. We have a conversation through the whole thing. People are laughing through the whole surgery. That's not unusual. Other people are really nervous, and we just get them through it. And but we're good at it, and those people are nervous. We just feel really proud to do it for them because we know they're nervous, and we do our best to help them out.
Kind of is an aside that Dr. Elmer or Dr. Endl and I just finished surgery just maybe an hour ago, and our very last patient came in tonight, and we talked to her, and we had her ready to come in there. She sat down, we put the hat on, and then it all became real, and she was a little bit nervous, and through the course of the next few seconds, she said to us, I thought there was sedative available, I'm really anxious, what can you do to help me? So recognizing that, we said, it's your day, it's your time, we're in no hurry, here's a little blue happy pill, you take this, and we'll see you in about 10-15, and this is your time, just you be calm. So 15 minutes later, we brought her in. She had the procedure done, and she just, to her, it was the easiest thing in the world. And I kept saying, "Are you okay?" She says, "Yeah, piece of cake." Now, 15 minutes previous to that, she was terrified. So,
yeah. It's good drugs.
We do understand how you are, and we do not belittle how you feel because we do it every day. You do it once, and we want to make sure it's comfortable. Another quick question that came in that's really important is, in terms of actually having it done, how far in advance do you have to book it? I mean, how far out are we booked?
Typically, when someone comes in for that couple-hour evaluation to make sure the eye health is in good shape and you are, in fact, a healthy candidate to have it, we're usually pretty close to being available to book what works around your schedule. So it would be unusual to be more than 2+ weeks out if you especially really need to do it. And again, sort of along the same lines as Dr. Elmer was just saying, we kind of like it when patients want to work and are trying to work around schedule. So there's almost always a time. We do surgeries on Wednesday afternoons, Thursday afternoons, and Friday afternoons. That allows us to have usually a fair amount of time to add on. And thankfully, as the procedure is only about 15 to 20 minutes from walking in and out of the entire room, both eyes done, and hearing all of Kevin's verbal anesthesia, it's unusual that we wouldn't be able to try to make room for you if it's an important date for you. Now, it is important to be out of hard contact lenses for a couple of weeks before your evaluation so that we can know your true shape, not your slightly warped shape from the contact lens. It is important to make sure that if we see on your examination there's not significant dry eye that we want to treat for a couple of weeks before we go ahead. But for most people, you can book your surgery very shortly thereafter from the examination itself, and it'd be unusual to go longer than a couple of months.
Now, we're getting a ton of questions, and I don't want anybody to feel like we're ignoring them because we're getting a lot of the same questions. But truly, if you have a question that we've not addressed so far, please, info@fichte.com, because each and every one of those are read and answered. Because in the scope of this half an hour or so that we have this Q&A, it's hard to answer everything. We also offer, as you obviously know, once a month an open house where you physically come in the building, see a procedure being done, talk to the doctors. We're here that evening. Spend as much time as you want. So click on the button if you'd like. The idea, just sign up for a consultation if you'd like. If we've answered all your questions tonight. And Dr. Elmer, there's two questions that I'm getting via my phone right now. Actually tweeted to me. This one's really important because I've had this a million times. People ask me this. Is they've been to other places, and we have a lot of other fine surgeons and whatever, but they go in and they're told, you're not a candidate for this. Your eyes are too thin. You can't have LASIK. They don't want to have a service treatment. So what advances have happened in the recent years or year or so that now allow more people, even if they've been told they have either a thin cornea or they're not a candidate, what makes them a candidate now? Talk about the technology, please.
Sure. When this center first opened, it was basically we had bladed LASIK. We didn't have intra-LASIK. And there was one laser and one surgeon, and that's all we did in this facility. Now, there's 3 surgeons, 4 lasers that we have available, plus we have all these intraocular lenses. We can change prescriptions that way. So really, the amount of technology that we have available today, we can't even talk about it in this seminar. There's just too much to talk about. Literally, it was before, yes, you're a candidate for LASIK or not. That's it. But the amount of options is really more than I can talk about. Multiple lasers, multiple ways of doing things. We can change the prescription by changing the cornea or change the lens on the inside of the eye. We can actually put in a lens in between the cornea and the lens itself. We call them like an intraocular contact lenses are available. So there are a lot of options. In addition to that, the lasers themselves are much, much more accurate than they used to be. We can actually take maps of the actual way that you're seeing eye and use computers and lasers to laser those in, so things are more precise. And then with the advent of laser flap making, we can make a flap with a laser instead of using a blade in the human hand, and that can be done thinner and more precise, which allows for more people to have the procedure.
Awesome. Well, one of the things that comes up a lot is, everybody hates glasses, and they wear their contacts to death, it seems like, to bed, to whatever, and you tell them, look, you have to be without your contacts for a period of time, and Dr. Endl's going to talk about why you have to go without your contacts and the difference between hard contact lenses and soft lenses, and really, why do we make them take their contacts out?
Yeah, we briefly touched on it before. When we take these wonderfully accurate measurements of your eye, we want to know your eye's true shape. In fact, our machines have gotten so advanced that if patients cheat a little and say, oh, I've been out of my contacts for a week or two, but it's really only been a day or two, my machine will say, this looks like question mark contact lens warpage. Sort of like an orthotic shoe that reshapes your foot. A hard contact lens, even more than a soft, and a toric lens or astigmatism lens sort of in the middle, reshapes your eye a bit to see better while that lens is in. But we don't want to know your reshaped eye, we want to know your truest shape. So although it's inconvenient to be out of your contacts for hard lenses a couple of weeks and soft lenses maybe 1 week, it gives us the best information so that the rest of your life you can enjoy your vision. It wouldn't be dangerous not to stay out for that period, but it won't be as accurate, so you don't want to cheat yourself, even though we'll probably catch you if you're a cheater.
Well, we're getting kind of close to the end, and we do these a lot because we know there's a lot of questions. There's a lot of interest in having this done, and we really like that. We like to have you come in. There's a couple of other ways you can gain information, that being go on our website and read through all the verbiage. You can request a packet of information they will send you. Dr. Elmer's holding up a card. So, in the mail you can very easily get information if you'd like to get it further that way. You can attend an open house. I'm going to save the best question for last, and I'm going to let Dr. Elmer answer this because it's a hard question, and a lot of people don't want to talk about money. But they want to know, how much is this? Is it $9? Is it $9 million? Because you're going to see ads out there for $2.99 an eye, which is crazy. You're going to see things all over the board. Talk to us a little bit about the average cost and why the average cost is what the cost is. Because this is not buying a used car or buying a Band-Aid. Nothing wrong with either one of those things. But talk about the costs, please.
Okay, so that's a good question. Does it hurt? Is it safe? And how much does it cost? So cost, we like to tell you what's the most it could be rather than do what Kevin was mentioning in bait and switch. A lot of companies will say, hey, this is the price, but once you get in there, you realize it's actually a lot more. So sort of the top cost is a little over $2,000 per eye for the procedure. The other question is, well, why is it so expensive? Wasn't it cheaper before? Doesn't the technology improve? The answer is, yeah, absolutely technology improves. If we use that old technology, we could literally do it for $100 an eye or less because the procedure, we use that old technology. But we've made a decision here at Fichte Endl Elmer Eye Care that we are going to have the best technology out there, period. If it's available, we're going to get it. If there's a machine that's going to, record what the surface of the eye looks like, and there's two companies, we'll buy both of them. That's why we have 4 lasers. So it's really the cost of the technology you're paying for. It's
5 lasers.
yeah. So that's it. So it's really the cost of this equipment. It's expensive. We have to buy it. We have to pay per use, and you have to pay maintenance fees on this machine. So yes, it's an investment. But I was listening to a lecturer today in my car telling like, if at a certain point of time, these investments almost always pay for itself because of the price of contacts, eye exams, glasses. There's a certain period of time that this technology is actually an investment and will save you money in the long run.
And plus, I think you should realize that my brother-in-law is an ophthalmologist in Los Angeles, and for an all-laser customized procedure, what we're typically going to recommend, simply because it's the safest way to give you the best chance of good quality vision, hands down, compared to all of the other lasers. When the NASA astronauts or the Top Gun pilots are available for a procedure, the armed forces have looked through all of the options to have the safest for their Navy SEALs, the safest for their Top Gun pilots, and this is the only thing they will allow them to have. To have that in New York City or Los Angeles, the exact same equipment we have, is about $3,500 to $4,000 an eye because of the cost of living, and that's what happens when you have the ocean across the street. So we have actually had people fly in from New York, knowing us from the University of Buffalo, take the JetBlue, have our procedure by someone who's done more of them than some of the surgeons there, and still save themselves a couple $1,000.
Well, thank you. I'd like to just finalize things tonight by saying thanks for attending. Really importantly, click on that button, sign up for a consultation. Any way you can get in to see us, we appreciate it. We appreciate you taking time out of your busy night tonight to join us. We're going to do this again, so look for more of these webinars, and thanks for joining us tonight. On that note, I'll say goodnight. Thank you.
Good night, everybody. Thank you.